Hello, and welcome to another episode of the Power Panel. Before we get started, I wanted to mention that today's Power Panel is brought to you by Myos MD, a cutting-edge nutritional supplement designed to combat muscle loss and support healthier aging. Powered by Fortitropin, a natural bioactive compound clinically shown to enhance muscle growth and reduce anabolic resistance, Myos MD is changing the way we think about muscle health. If you'd like to learn more about MyosMD, you can go to myosmd.com to learn more. All right, well, into today's episode, we are so excited to have our guest. So let's just go straight into it. Could you tell us a little bit about yourself and the evolution of your clinical practice?
Well, and thank you, Dr. Swathi. I'm very, very excited to be here. I'm Dr. Victoria Mondloch. I'm actually a retired OBGYN wellness doctor. In my practice, I also incorporated complementary alternative medicine, energy medicine, and regenerative medicine. So my approach was a very holistic, total approach to how the body works. But my background and initial training and board certification was OBGYN, or women's health. So I did traditional practice for 16 years, and I incepted a clinic within a clinic in my 8-physician group because I was going through perimenopause and I didn't understand what was happening to me. And my office manager looked at me and said, "Well, Doc, if you don't understand what's happening to you, how do you expect your patients to understand what's happening to them?" And I thought, boom, that's brilliant. Of course. So we incepted a whole program that paid attention to women where they were at in their hormone journey. And we were actually drawing hormone levels. We were inviting women to come in and in a half day, do everything that's expected for your health on a once a year basis. So we would do their breast screening. We would do a bone density. We would do their labs. We would feed them a heart healthy breakfast, but then give them a consultation for personalized exercise for them, a personalized dietary consult, give them a massage, give them an acupuncture treatment, give them their annual exam, and then compile all of the results from all of that in a letter that went to them and back to their primary doctor. So they only had to take a half day off work. That was it. It was hugely successful, but my partners wanted more surgeries. We're not getting enough procedures from this. We want more, more operations to do. This isn't working for us. So when I went around the room and asked my partners, "Do you want this program or not?" Despite the fact we've got 3 times the referral of new patients coming into the office, they actually all raised their hands and said, "Nope, get rid of it." So I took, and this is 1998 when they said get rid of it, or 99. So I took a piece of paper and I wrote, "I quit." I was the president of the organization. I put it in the middle of the table and I walked out. So then I had to figure out, okay, smarty pants, now that you've made your point, now what are you going to do? So I went solo and I developed my system of taking what I learned from that program, that clinic within a clinic, and doing it one-on-one for my own patients. So I went further than that, and I actually incepted what I call the optimal health model, which is balancing the 4 main hormone groups in your body. And my patients allowed me to do, with their consent, research on them for the next 20 years. And that's what gave me all of the information to actually write all of this down for every woman to have. And those are in my books. So I've written 2 books that explain what my research was all about, but it's basically Are you age appropriate for your hormone levels? Not just are you in reference range, but are you where you should be for your age? And if not, why not? And how does that impact your health and your future health risks? And are you able to mitigate disease that may even be genetic in your family, like BRCA and breast cancer? Can you mitigate that by knowing your hormone numbers? And can you mitigate a family history of risk of heart attack and stroke? Can you prevent osteoporosis and reverse it? Can you prevent Alzheimer's? And the answers to all of that come out of understanding and knowing if you are where you need to be and are you balanced with your 4 hormone groups.
Wonderful. Wow. I have so many follow-up questions. So the first one I'd love to ask, so you started talking about this a little bit, but why do you believe the conventional medical model has fallen short in supporting women through these transitions? So specifically perimenopause and menopause.
Well, as I make my statement, every woman will be nodding their head yes, is that Western medicine wants to write you a prescription and they want to put you on a medication. And if you understand that bioidentical hormone and rebalancing you is not pharmaceutical, it is natural. And you cannot patent something that is natural. So the pharmaceutical medical complex is not going to benefit. And in today's present system in the US, 77% of physicians are employed, which means they have a boss over them that tells them what they can do and what they can't do. And women coming in requesting their hormone levels to be checked, the physicians are told, you can't go there. That's the real answer to that question. The other answer is it isn't taught in medical schools, believe it or not. 15% of US medical schools give a very small amount of attention in their curriculum to hormone and even how to measure hormone. There are no real established graphs for age appropriate hormone across a woman's menstrual cycle. Women hearing this, you should be absolutely amazed and just horrified. What do you mean our doctor doesn't understand what we're going through? They don't even have the grasp of where you should be.
Absolutely. And as you're working, or as you used to, work with women directly, you emphasize that women should be thriving and not just surviving during these transitions. So what does true well-being look like during menopause?
Well, I'll give you an example of what my patients would say to me is, Doc, I feel 15 to 20 years younger than my age. How do I keep this? We just keep balancing your 4 hormone groups. It's blood work. It's really that simple. And they'd look at me and go, that's it? That's it? And they would bring their husbands in. Will you do this for men too? Sure, works for men as well. Can you do this for my parents, 20 years older than I am? Sure. Will it work on my kids? Sure. In other words, balancing the 4 foundational hormones of how your body works is a tried and true formula for good, optimal health, regardless of your age. So it works whether you're 20, 40, 60, 80, it works regardless.
And so you mentioned blood work. So what are some of the, lab work or patterns that healthcare providers should be paying more attention to when working with women in their 40s and beyond?
Well, I'm going to show you a graph that's going to actually, from my research, and that's part of what I wrote the books based on. I'm going to show you a graph that's going to surprise you. When we talk about traditional labs, what we talk about is you get your labs done and you get a reference range. Are you in range? Okay. Well, I'm going to say that's not the best way to look at it. I want to know not just are you in reference range, but are you age appropriate optimal? Ooh, now that's a different endpoint. It doesn't mean you're not in the reference range. It just means you're where I want you. So what does that look like if you graph it out? Well, a woman's menstrual career from 20 onward, if you measure their female hormones, you will see that they're high in their 20s and 30s. And then once you hit your 40s, you are doing this very up and down, very schizophrenic kind of curve. And so you may measure 1 month in your 40s, you may measure at 70th percentile for your hormone. The next month you may measure 30th. Does that mean your body is off and it needs to reconfigure? Well, it's understanding, number one, that that's happening. And then if it's giving you symptoms that are getting in your way, then yes, 30% may be too low for you. The swings may be too drastic that if we can change those swings, I can't change you going through perimenopause, but I can change the impact on you. So instead of a wild swing, make it a little bit less, make it easier to handle as you make that step down. So it's all about knowing what your symptoms are, where you as a woman are at, and what your numbers are. But understand your whole menstrual career is like a bell curve. And so you start low, you reach your peak in your 20s, 30s, and then you come down. But that's the average. What really happens is that sawtooth swing. And I'll show you one more graph, because in the adolescent, what happens is actually something that is very akin to what happens to a woman in her 40s. This is the woman in her 40s. This is the adolescent.
Wow.
The same sawtooth schizophrenic swings. So it's like mother, like daughter. So it gives us that aha understanding of, no wonder I clash with my teenage daughter. We're going through the same swings. But unless somebody shares that with you, or unless you can prove it with science, which is your blood work, you're guessing. And you're guessing, and you're letting your doctor guess because he's not doing the blood work. And his only resource is to say to the mom, well, we'll put your daughter on birth control. We'll just take care of it all. But I don't want my daughter on birth control. I want to understand what's happening. Well, we just know it's adolescence and she'll get through it. Well, wait a minute. I want science. I want an answer. Give me something I can actually understand. Well, we just will put her on the pill because they don't teach this. So my job, as I've retired, is to empower and educate women about how their body works. How can we help our daughters understand what's going on with them? Why does one daughter have migraines before her period and the other daughter doesn't? That doesn't make sense if you look at it from a genetic model, or from you're raising your daughters the same way. Why is there such a drastic difference? And then women in your perimenopause, menopause, why? What's the science behind why one woman who sits next to you at work may have short-term memory loss, but no hot flashes? You're having crazy hot flashes and muscle pain and joint pain, and sex is like having razor blades instead of enjoyable. And why is there such a difference woman to woman? Well, it's all about where you are and where are your hormone levels. Again, put the science into women's health. Know your numbers.
Yes, and speaking of numbers, so what about lab work? So of course we're going to check hormone levels, and some of that, is in blood, some of that is in urine, but what about like other lab tests that healthcare providers can consider?
Well, and I'm so glad you asked that question, because it is so much more than just where are you female, male. There's actually, I want you to think about a chair that you sit in. A chair is 4 legs. And if you sit on a chair with a broken leg, or your female male hormones are off, then you sit on that chair with a broken leg and boom, you're on the floor. You don't even know how you got there. So you rewrite the chair and you sit back down on that chair and boom, you're on the floor again. Well, isn't that the definition of insanity? You do the same thing, but you expect a different result. So one leg of that chair are your male female hormones. And if they're already swinging, then that's already an unstable leg. Okay. The other 3 legs of your chair are the other 3 foundational hormone groups in your body. And you go, whoa. And they're labs that your doctor doesn't routinely run. So yes, many will do a token thyroid test, but not everything that you need to know. They will not check your morning cortisol. They will not check your insulin. Ooh. So those 4 hormone groups have to be optimal to balance what your body's foundation of health is all about. So what if you have not just 1 broken leg, but you have 2? Well, now the other legs are more stressed to help out the 2 broken legs. So you may now break a 3rd leg or a 4th leg. Well, women who would have all 4 of these hormone groups out of balance were the patient that would walk in and say, I don't feel good and nobody can tell me why. So those 4 foundational hormone groups are key. Yes, there are other ancillary labs that will help support those, like vitamin D, which is all about your immune system and support to the other hormones. It's knowing inflammatory markers so you know areas you need to go after. It's about how do you support your cortisol, which is your B12, in particular methylated B12, because many of us in the population are missing the methylation detox gene to clear garbage and breakdown of how cells work, to clear it out of our cells. So we collect all that garbage in our cells, in our tissues, like a hoarder's house. We never clear the garbage. So how can your cells work if you're navigating between rows and junk and things you can't clear? So these are things that male and female we need to know. But the basics, the 4 main hormone groups, need to be checked. And I list them in the back chapter of both books. The chapter says how to talk to your healthcare provider. So I'll tell you the list of labs to do right there. So what if your doctor says, no, I can't do those for you? Well, you have 2 choices. You can find another doctor that will do them for you, or know that you can order your own labs. What? Most people have no idea they can order their own labs. Does that mean I'm paying for it out of pocket? Well, you may actually be able to use your HSA or FSA funds, but otherwise, yes, you will not be paying the typical cost that if your doctor doesn't order it and or doesn't code it right, that you would be paying the marked up price. You're going to pay a much lesser price ordering it online yourself. And then you're going to have those results sent back to you, so you have control over who you send those results to. So what lab do I recommend? I actually recommend going on the computer under Life Extensions, go to their lab tab, and you'll see all of the lab profiles you can order. It's an extension and subsidiary of LabCorp, which is a national lab, coast to coast.
Yes, amazing. So I'm so glad you dove into the lab tests. So let's talk about clinical symptoms like hot flashes and mood changes. What are overlooked symptoms or concerns that you see frequently or you used to in your practice for women who are going through perimenopause and menopause?
Oh, and it's a long list, and my list, which I'll be very willing to share with you, that you can actually post on your podcast site and offer it as a free resource to everyone listening. But it is actually a very comprehensive hormone symptoms worksheet, that there are estrogen deprivation symptoms, there are progesterone deprivation symptoms, and excess testosterone symptoms. So this list of symptoms is every organ system in your body from head to toe. And it's a more comprehensive list than the American Menopause Society's list. But again, realize what this resource can do for you is it can categorize your symptoms by which hormone is off or out of balance, so that you have an idea where you stand, and you can actually do it as an intake to take to your doctor and say, I have 10 things on here, but a lot of them are over here. But this one over here, oh my gosh, mid-abdominal weight gain, doc, you got to help me with this. So in other words, what it gives you is validation that your symptoms are real. Nobody thinks about short-term memory loss, brain fog, as related to low estradiol. Nobody thinks about abdominal bloating as too low of a progesterone. Nobody thinks about having migraines and headaches as related to either being low. Nobody equates your mid-abdominal weight gain to excess testosterone. What? So there are many symptoms that go along with my hormone is not balanced. And that's the beauty of this, is you can actually start with where you started and track as you go forward. Are things improving with either diet and exercise? Are they improving with herbals? Are they needing something more? Because vitamins and supplements will take many people to more normalized symptomatology, but at some point, we go from 100th percentile at age 30 to 0. And that's a big drop. That means your ovaries decide, I'm on vacation. Sorry. See ya. Good luck.
Wow, that's great. I'd love to ask you a question also. When you were talking about the symptoms, it made me think of something. So what about like muscle loss? So how does muscle loss relate to estrogen? And what do providers need to understand about this connection, particularly, when it comes to estrogen, but also other hormonal changes and muscle over time?
Well, and muscle has many receptors, many needs. It needs to be well hydrated. It needs to be exercised. It needs to have, the ability to clear junk out of it. and it literally just needs to be nurtured and cared for. So knowing lifestyle is a huge factor in there, is a major part of it as your foundational baseline. But then undue muscle pain and muscular fatigue, deep bone chilling fatigue, is actually a low estradiol symptom. Muscle loss can actually be a combination of dropping estradiol and dropping testosterone. But the little dirty secret that nobody ever tells women is that when you get to menopause, ovaries will stop making female hormone, but they don't stop making male hormone. So we actually become testosterone dominant. What? In menopause. Now, some testosterone will convert a small amount to estradiol. And you go, oh, phew, good. But there's no countering progesterone to counter the female. So now we become male and we become estrogen dominant. Estrogen dominance can actually hyperstimulate female tissues like breast, uterus, ovary, and it can predispose you to a bad mammogram, postmenopausal bleeding, polyps, cancer of ovary and uterus. So these are health risks that nobody tells women. They just say, oh, you got to menopause. You ran that race, you crossed the finish line, and the curse is gone. Well, wait a minute. You didn't tell me there were risks of not keeping my hormone on board or keeping me at a minimal amount to protect against breast cancer, to decrease heart attack and stroke, to decrease risk and reverse osteoporosis back to normal, to actually reverse and prevent Alzheimer's. Nobody tells you that, or nobody's going to tell you that at age 70, 75, you might start losing teeth in your mouth. But doc, I'm in perfect healthy shape. I don't take any medications. I'm ideal weight for height. But my dentist said I might lose all my teeth. Well, you may have such bone loss going on in your jaw, you can't hold your teeth. So now you need implants, which to the tune of your whole mouth may be $40,000. Wait a minute. Nobody tells people these things. So why don't we? Well, again, you can't patent female hormone if it's natural. Follow the money.
Right, absolutely. And so in our, final minutes together, I would love for you to share some key takeaways from your books that you've mentioned a few times, but what are some of the key takeaways, particularly for women who are going these, stages of hormonal change? And I mean, I would love to hear just from a personal standpoint too. I mean, it's 20 years of compiled data. So what are some of the things that you'd like our listeners to take away from it?
Take charge. In other words, advocate for yourself, educate yourself, whether you're a fan of buying books and reading them, or you want it, or Kindle electronic. I'm sorry, they're not audio, but educate yourself and do what I tell my patients to do, is take charge. And I'm doing a free online book club April 30th, and I can get that link to you that you can list for your listeners. But it's a book club for Full Bloom. And it's a way to help women be able to hear it directly from me as we go through the book. But take charge. Do your symptoms. Know that there are age-appropriate levels you should be at, so get your blood work done. I tell you that in the last chapter of the book. And you will be as able to have a conversation with your healthcare provider as they will let you have. If they don't want to engage you, then I'm going to say you might like your doctor, but they're not helping you right now. Find somebody who can help. You may need another doctor. Mm-hmm.
Absolutely. And I love the tip as well that if people are interested, they can actually order their own labs, and there's more than one company out there through which you can do that. Well, amazing. So, as we wrap up, we'd like to thank our guest for sharing her expertise today. And we'd like to thank MyosMD for sponsoring today's Power Panel. Fueled by the revolutionary proprietary ingredient Fortitropin, MyosMD is trusted by healthcare providers nationwide to deliver real results backed by science. So, again, if you'd like to learn more about MyosMD, please go to myosmd.com. We have a number of other experts and recorded sessions of different power panels on our website, as well as on YouTube. And this will be shortly also live on YouTube and our website. So yes, please do not hesitate to reach out to either of us. So whether that's the Myos team or Dr. Mondloch. So could you please give us some information on how our listeners can stay in contact with you?
Absolutely. I'm on LinkedIn. So all you have to do is put Victoria J. Mondloch and my name will pop up. So you can contact me via LinkedIn. I'm on Alignable, which is another networking kind of site. And Alignable, I'm on it's the same name. My email address is my first initial last name at gmail.com. So VMONDLOCH at gmail.com. And I'd be happy to have, pass on any other information that I can give to you. I'm here to educate and empower.
Amazing. Yeah, thank you so much. I'll be following up with you to get the link so that people who are listening to the recording or the live today can be a part of your book club. All right. Well, thank you so much and have a wonderful rest of the week.
Thank you. And thanks again for the opportunity.
Absolutely. All righty. Bye-bye.